Well, let's get some reaction now to the government's third attempt to means test the private health insurance rebate. I'm joined from Canberra by Dr Michael Armitage. He's the Chief Executive of the Australian Health Insurance Association. That's the body representing health funds in Australia. Michael Armitage, as I just mentioned, there are some reports that the federal government has secured the 3 crossbench votes necessary to means test this private health insurance rebate. Is that what you're hearing?
Look, I'm not hearing that. But even if I were hearing that, I wouldn't be concerned at this stage, because it's my direct experience that the bill doesn't pass until all the votes are counted, and we're still working hard with the independents, making the case that this is a very bad thing for the whole of Australia's healthcare system, and we would hope they'll continue to listen to us. Well,
we know that the government has the support of the Greens, and with Andrew Wilkie telling the ABC that the federal government is very close to securing his support, it would seem, though, that you're fighting a losing battle. How do you hope to persuade some of these crossbench MPs to toe your line?
Well, we provided Mr Wilkie's office, and indeed I had a quick chat with Andrew himself just before he did the interview that you're quoting, with some new research which was only released a couple of hours ago, which indicates that the basis of the government's claims that private health insurance is the fastest growing area of healthcare, that it's going to save $100 billion, that they should even use a 40-year time frame, etc., are just simply invalid. So we think that we are giving the independents, and indeed a number of Labor members in marginal seats, because this is a very popular initiative, the private health insurance rebate, we're giving them food for thought, and we would hope that they would consider the effects of the legislation on their constituency and on all of Australia's healthcare.
So if the private health insurance rebate is means tested, how many people do you think will drop insurance?
Well, we've done studies independently, I'm sorry we didn't do them, but they were our studies, by the best in the business. Rod Cameron from ANOP, that the Labor Party has used for its electoral polling for 30 years. We then had those figures modelled by Deloitte with the same modellers that the government used for their climate change analysis. And they say that 180,000 or thereabouts people will drop in year 1, and many, many hundreds of thousands will drop over a 5-year period. But what's really important, Kim, is that they say in the report, as do other reports, that the real nub of this matter is the number of people who will downgrade their insurance. And sadly, the government didn't model that, because it just simply forgot that people can downgrade their insurance without any Medicare levy surcharge penalty. So the whole basis of what the government's doing is flawed, which means that the effect on the public sector, when all the people who are privately insured drop out, will be very dramatic. And that's why we say everyone ought to be concerned about the legislation.
So what does your modelling say about how much the cost of private health insurance will rise if these people do indeed drop out?
Well, look, we understand that people don't like private health insurance going up, but we have to cover the cost. That's part of the legislation. And the costs will keep going up year by year. But the work which we had done says that there will be an additional 10% in the premium demand just because of this legislation in a 5-year period.
So now, you're warning Australians who stick with their private health cover that their premiums are definitely going to go up 10%.
The report says that if the legislation passes, there will be a 10% additional hike in premiums, depending upon all the other factors, because directly of the legislation.
Well,
and we know that that's unpopular.
Some people, it might be unpopular, but some people could also argue that private health providers are very profitable companies, and perhaps those companies should just absorb these costs if indeed people do drop out.
Yeah, Kim, the trouble is that's what people say, and we understand that. The facts don't back that up. I mean, the independent regulator says a number of things, but in particular in relation to the net profit margin, they say that these funds make a net profit of somewhere between 2 and 5%, depending upon the year. Now, that's not a lot of profit. Once they've taken out expenses, it's not a lot of profit, and the vast majority of what people pay back goes out in benefits for members who have operations and so on, which is exactly what insurance should be doing.